Hi, I'm Dr. Ronny Tan. I'm a consultant urologist from Mount Elizabeth Hospital. My subspecialty is in the field of andrology, men's health, and urological prosthetic surgery. When the patient does not want to take chronic medications, they want to stop medications, they will consider doing a surgical treatment. Also, patients who cannot tolerate the side effects which cause sexual dysfunction will also opt for surgical treatment. So Urolift is a placement of these implants called Urolift. The implants will actually push aside the prostate that's obstructing the flow of the urine. Unlike TURP and green light laser, we actually damage the tissue by either removing the tissue or vaporizing the tissue. In the Urolift, we actually do nothing to the tissue except we just draw them apart. So patients who undergo TURP or green light laser, although the flow is definitely good, the downside is they will lose the ability to ejaculate. Whereas if we do Urolift, because we do not damage the tissue, the patient still retains his ability to ejaculate during sexual activity. So men who are still sexually active and they are not keen to continue with the medications because of the side effects, or men who just don't want to take any long-term medications, these are a group of patients that are suitable for Urolift. They still need to be evaluated in terms of the size of the prostate, in terms of the configuration of the prostate, so that it can have the best outcome. Most of these patients can go home on the same day. So if you compare to TURP and green light laser, they require the placement of a urethral catheter. Most men who undergo Urolift do not require the placement of this catheter, and they can be discharged with minimal side effects. The common side effects that they may have will be dysuria or urgency, the sensation of the implant because it's just been placed. After a while, the patient actually gets accustomed to it. In terms of bleeding after the procedure, usually most patients only have a slight bleeding for the first 1 to 2 days, and their daily activities are hardly affected.